New government data released this week, which made headlines across the nation, shows the coast-to-coast opioid epidemic is flooding hospitals. The 2014 numbers released by the Agency for Healthcare Research and Quality puts Massachusetts in the top 10 states with the highest rate of opioid-related hospital admissions. Locally, several groups are working to help to educate and ultimately prevent young people from falling into the path of drug addiction. Julie Bollier has more.
Megan is a heroin addict in recovery. At age 13, she started drinking and using drugs.
It was alcohol and cocaine. I started because I wasn't happy. There were things in my personal life with my family that made me just not feel loved and not know, who I was as a person. I felt really alone. So I clung to whoever liked me, and it just happened to be the wrong crowd of people that had similar problems as I did, and we partied, and alcohol and cocaine made me happy.
In Megan's case, her drug use spiraled out of control until an overpowering heroin addiction landed her in jail.
I would tell a 13-year-old, if they were struggling the way that I was, I would definitely first and foremost tell them that they're not alone, that they have people who love them for who they are, that there are so many supports and outlets that they can use to get the help that they need.
Studies such as the National Survey on Drug Use and Health, reported by the Substance Abuse and Mental Health Services Administration, indicate that some young teens are already abusing drugs at age 12 or 13. Early abuse often includes tobacco, alcohol, inhalants, marijuana, and prescription drugs. If drug abuse persists into later adolescence, abusers typically become more heavily involved and advance to other drugs. Sacred Heart Parish in Feeding Hills continues to take a proactive approach. The parish nurses, who are part of Mercy Medical Center's faith-based nursing program, held its second substance abuse seminar this spring. Lieutenant Frank Matuzek of the Agawam Fire Department brought home a harsh reality.
Some of the hardest calls that we see are calls that involve kids, and usually they're younger teenagers that just got involved in it. And unfortunately, the parents usually find them the next morning.
The first thing you can do to keep your home safe is to get rid of any unused prescription drugs. Call your local police department's non-emergency number to find out where the nearest drop box is, and make sure any needles are placed in a safe container. If you come across a needle outdoors or on the street, do not pick it up. Call 911 and ask for instructions. Drugs can be purchased online. Demos on how to use drugs, grub drugs, and chemically make drugs are also available on the internet. Educators and parents of Pope Francis High School recently attended a seminar entitled Drugs from Streets to School.
These are things you might see in a backpack, in a bedroom, and the fact that you can hide things in something that's just, as he says, hidden in plain sight, we should be aware of that and know what to look for.
Presenter Eric Stratton is also an area emergency medical technician, sharing info with parents on drug lingo, use, and how they're bought, as well as disturbing videos posted online by teens and young adults making and doing drugs.
So over the years I've collected information, collected paraphernalia, so that I could teach others from law enforcement, EMS, now the public, what heroin, what drug paraphernalia looks like. So that's like the strong teaching point from my class. I still work the field, so I do these overdoses and I see the effects of drugs on people, and I'm just trying to share the information with others.
Stratton's advice to parents: Notice any changes in your child's behavior or routine. Look for empty bottles or drug paraphernalia in your child's room or around the house. Also look and keep track of any prescription drugs and notice if any are missing. Then look for things hidden in plain sight, such as water bottles or soda cans with secret compartments. Finally, talk to your child. There are several resources available to help. I'm Julie Bollier for Reel to Reel.
Certainly, substance abuse of any kind should not be taken lightly, and we have several links providing help with resources on our website at iobserve.org.